Imagine being told at your checkup, you have a fatty liver, and then hearing the doctor add, at your age, it just is what it is. Many people over 60 walk out thinking the damage is permanent and there is nothing they can do. Online searches do not help. One article promises a miracle cleanse in 7 days. Another says it is too late once you're older. No wonder people feel confused and scared. Here's the honest question behind this video. After 60, can you really reverse fatty liver, or is it only about slowing things down? The short answer from current research is both hopeful and realistic. In many people, extra fat in the liver can be reduced or even cleared if you change the conditions that put it there. At the same time, advanced scarring is much harder to undo, especially later in life. In this video, we will look at how fatty liver works, what the science actually shows about reversal after 60, and the concrete steps that still matter at your age. First, what exactly is fatty liver? Your liver normally contains a small amount of fat. In fatty liver disease, much more fat accumulates inside the liver cells. For many people, this is linked to excess body weight, type 2 diabetes, high cholesterol, or a diet rich in refined sugars and saturated fats. Some people have fatty liver due to alcohol, others have a mix of causes. At the beginning, this extra fat usually causes no obvious symptoms. You may feel normal while silently carrying a liver that is heavier and more stressed than it should be. Fatty liver is not just one single stage. Think of it as a ladder. On the first rungs, there is simple fatty liver, where cells are full of fat but there is little inflammation or scarring. Higher on the ladder, long-term fat triggers inflammation and injury, and the liver starts laying down scar tissue. This scarring, called fibrosis, can progress over years to cirrhosis, where the liver becomes stiff and much less able to do its work. This matters because fat is easier to remove than scar tissue. The earlier you act, the more of that change is still possible. So what does the science say about reversing fat in the liver? Multiple studies show a clear pattern. When people lose a moderate amount of body weight and keep it off, the amount of fat in the liver often falls sharply. In many, simple fatty liver disappears on scans and blood tests. Doctors see meaningful improvements with as little as 3 to 5% of body weight loss. Around 7 to 10% weight loss, there are often reductions in inflammation and early scarring. With losses of 10% or more, some patients even show regression of fibrosis as long as they haven't yet reached very advanced cirrhosis. This dose-response pattern has been seen in large groups of patients followed over time. Older adults are included in many of these studies. The liver remains a remarkably resilient organ, even in later life. It can respond to better blood sugar control, less abdominal fat, and healthier blood lipids. That means that if you're over 60 with mild or moderate fatty liver, there's a real chance to improve or even normalize your liver fat pattern with sustained lifestyle changes. Age does not erase that potential, although other health issues may affect how far you can safely push weight loss and exercise. There are, however, real limits. If you already have significant scarring or cirrhosis, the goal shifts. Some people can see partial improvement in fibrosis, but complete reversal is much less common, and the focus becomes slowing progression, preventing complications, and reducing the risk of liver cancer. Medicines are beginning to appear for more severe forms of fatty liver with inflammation and scarring, but even with these newer treatments, lifestyle change remains the foundation. The same habits that drive fat into the liver also raise the risk of heart attack, stroke, kidney disease, and diabetes, so changing them helps more than one organ. What does an evidence-based plan look like for someone over 60? The first step is information, not action. Ask your doctor what stage your liver disease appears to be in. That may include blood tests, an ultrasound, or a special scan that measures stiffness, and sometimes a biopsy. Ask directly whether there is scarring and whether alcohol plays any role. Knowing where you are on the ladder turns vague fear into a clear starting point. The second step is gentle but steady weight management if you carry extra weight. The science suggests that aiming for about 5 to 10% weight loss over 6 to 12 months is both realistic and powerful for liver health. That's very different from crash diets or extreme fasting, which can be risky for older adults and may strip away muscle. You want to lose fat while keeping or even gaining strength. Working with a dietitian, if possible, can help you design meals that fit your culture, budget, and digestion. Third, look at the pattern of what you eat, not just the total calories. Diets by emphasize vegetables, fruits, whole grains, beans, nuts, seeds, olive oil, and fish, and that cut down on sugary drinks, white bread, sweets, and heavily processed foods are linked with less liver fat and better insulin sensitivity. For someone over 60, this might mean exchanging a sweet breakfast cereal for oats with berries and nuts, swapping soda or juice for water or unsweetened tea, and planning most dinners around vegetables and a modest portion of lean protein rather than large servings of red meat. Fourth, move your body in ways that your joints and heart can tolerate. Regular physical activity helps your muscles use sugar and fat more efficiently, so less ends up stored in the liver. Many guidelines suggest at least 150 minutes of moderate activity each week, plus simple strength work 2 to 3 days per week. If that sounds like a mountain, start with the ground under your feet. A 10-minute walk after meals, repeated most days, can already improve blood sugar patterns. Sit-to-stand exercises from a sturdy chair can build thigh strength that supports more walking later. Alcohol deserves its own mention. If your fatty liver is related to alcohol, or if you have mixed metabolic and alcohol-related injury, stopping or sharply reducing drinking is often essential for any chance of improvement. Even if your fatty liver is not from alcohol, a liver that is already dealing with fat and inflammation is more vulnerable to alcohol than a healthy liver. For many older adults with fatty liver, the safest target is no alcohol or only very small amounts under medical guidance. Finally, remember that fatty liver rarely lives alone. Conditions like high blood pressure, type 2 diabetes, abnormal cholesterol, sleep apnea, and obesity interact. When you work with your doctors to bring those under better control, you're also treating your liver. Sometimes medicines for diabetes or obesity that promote weight loss and improve insulin sensitivity can have positive effects on liver fat as well. Your team can help decide which tools make sense for your body and your stage of life. So, can you reverse fatty liver after 60? For many people with early or moderate disease, the answer is often yes, at least partly, and sometimes quite dramatically, if you give your liver a new environment to live in. For those with more advanced scarring, full reversal is less likely, but slowing or even halting further damage is still a huge win. Every step towards a healthier weight, a calmer blood sugar pattern, more movement, less alcohol, and better managed blood pressure is a signal to your liver that the storm is easing. If you've been told you have a fatty liver, don't let fear or shame freeze you. Take that information as an invitation. Begin with a conversation with your doctor, choose 1 or 2 changes that fit your reality, and build from there. If you'd like more clear, science-based guidance on protecting your organs as you age, consider subscribing and staying with me on this journey. Your liver is working for you every minute. It deserves a plan, not a miracle claim.